you cannot say that there was just a single trial done on ACE inhibitor in hypertension, and now we can say that ACE inhibitor has its efficacy in hypertension. There would be thousands of trials, if not thousands, hundreds of trials done on ACE inhibitor in hypertension, beta blocker in hypertension, calcium channel blockers in hypertension. So now, if you have a lot of trials on a single PICO, I will teach you guys what is PICO. But before that, I'm just giving a short introduction. Okay, so we have 50 trials on ACE inhibitors in hypertension, 50 trials in beta blockers in hypertension, 50 trials on calcium channel blockers in hypertension, different trials with different intervention in a single disease. Now, who decides and how they decide that this drug has more efficacy than the other drug in this disease with less side effect? There's need of a single study that pool all the results, that pool the analysis. So for that, we need meta-analysis. In meta-analysis, we pool all the results of different trials matching a single PICO, and then after pooling the results, we find out that the efficacy of ACE inhibitor is greater than beta blockers in hypertension, and the side effects of ACE inhibitors are less. I would say ACE inhibitor is a more safer option for hypertension than beta blocker. So this is how you pool the results of different trials analysis. So focus focus on the PICO now. I'll share my screen and I'll teach you guys what is PICO. What is my population? Okay, hypertensive patient. Perfect. What is my intervention? What is my intervention? Drug, yes. And what is my comparison? No, I'm not. I'm not comparing it with beta blockers. I'm it's placebo. It's placebo. Yes, it's placebo. If I say ACE inhibitor versus beta blockers in hypertension, then I am comparing it with beta blockers. But here I'm not comparing it with beta blocker or any other hypertensive drug. It's just a placebo. Okay. What are my outcomes? Yes, efficacy is my outcome, and also side effects. What are the side effects?
जो भी screen edit कर रहे हैं, I'll remove you from the meeting. So please don't do it.
Please kindly don't do it. स्क्रीन पर जो भी लिख रहा है काइंडली डू इट. ये बच्चों वाली हरकतें छोड़ दो, ठीक है? एंड मैं बहुत ऑनेस्ट होकर आप लोगों को यहाँ पर पढ़ा रहा हूँ, और काइंडली डोंट डू इट. अगर मैंने स्पॉट कर लिया तो I'll remove. Okay, now I have a PICO. My P is inhibitor, and my population, sorry. My population is hypertensive patient. Okay, my intervention is inhibitors. And what is my comparison? That is placebo. And what are my outcomes? That is efficacy. Okay, so now I'm going to tell you how how to find a topic on a specific PICO. Should you decide a PICO before finding a topic or not? You shouldn't have any PICO in your mind. You should have a domain in your mind. In 2025, I have done more than 25, submitted more than 25 uh, meta-analysis, and out of 25 meta-analysis, 20 to 22 topic. I found 20 to 22 topics based on these techniques that I'm going to tell you. So only four or five of them are published yet, and some of them are in peer review, some of them uh, with editor. I'll resume. Okay. The first thing, you should have something in your mind. Okay. You have something in your mind, like you have prednisone and lupus causing nephritis. You have this in your mind, and now you want to find a meta-analysis topic on this. So how you find a topic? Now you have a PICO in your mind, prednisone and lupus causing nephritis. So you search for your PICO on PubMed, and uh, but before that, you can ask ChatGPT to help you in making a search string for your PICO. You have a PICO. This is my PICO. Okay, now you have a search string. Just copy the search string, go to PubMed, and search it. Now you have results, you have studies. So what you have to do is, सबसे पहले click on this meta-analysis. I put my search, I put my PICO and ChatGPT. You can see the PICO, prednisone and lupus causing nephritis. Make me a PubMed search string, and ChatGPT made me a PubMed search string. Not ideal, but ChatGPT can make you a very better search string. So I have a search string, and then uh, just simply paste the search string on PubMed, and you'll be having a result. Okay, now I have a result. Um, okay, so when I searched when I pasted the search string on PubMed and searched it, I got 1014 results. Okay, I will click on this meta-analysis. Why? Because if there is already published meta-analysis on my PICO, is it possible for me to do another meta-analysis? I'm asking a question. Is it possible to do another meta-analysis? No, no, maybe, no. Okay, so maybe. Maybe is the answer. Because if there is a previous meta-analysis, maybe you can update the previous meta-analysis. And if you don't have the option to update the previous meta-analysis, then you cannot conduct another meta-analysis. So just leave it and search for something else. Okay, now I am searching impact of its prednisone and glucocorticoid. They're the same. So impact of glucocorticoid dose on complete response, serious infection, and mortality during the initial therapy of lupus nephritis. Okay, so I have a meta-analysis on a certain PICO. Simply leave the topic. I cannot conduct a meta-analysis on this. Now, I will ask ChatGPT. Okay, ChatGPT भी आज धोखा दे रहा है मुझे. छोड़ो चैट जीपीटी को, खुद करते हैं. I'll change the population. I can change intervention. I can put a comparison group to it and then search it again. Okay, now I have this search string. Okay, lupus nephritis and prednisone and treatment outcomes. I just simply remove the outcomes and I'll put a comparison here. Okay, so what I can put is what is the alternative treatment option for lupus nephritis. Just Google it. Have diuretics, hydroxychloroquine. Okay, we can compare hydroxychloroquine with prednisone and lupus causing nephritis, and then search for it. There's no meta-analysis on this. Now, if you have, I'll share my screen. Okay. Okay, so I changed the PICO, and instead of placebo, I took hydroxychloroquine as comparison to my intervention. Now I have no meta-analysis on this PICO. So if you don't have meta-analysis on a certain PICO, what you can do next, you can search for clinical trials or original studies. At least you have 3 to 4 regional studies. If you find 3 to 4 regional studies on a certain PICO with no meta-analysis, congratulations, you have a topic. So now I'll just simply search it and okay, I'll look for something that is matching my PICO. Hydroxychloroquine and systemic lupus erythematosus. No, I'm looking for nephritis. No, no, no trials. No trials whatsoever. So if I change the PICO, studies khatam ho jati hai. So now what is the next technique? Search for your disease on PubMed. Now this is important. This is very important. Just search for the disease that you are interested in and want to do a meta-analysis. Just search for the disease, and after the disease, uh, we are going to apply some recent filters, 2024 and 25. Okay, publication date, 1 year. Okay, I will also apply the filter clinical trial and a randomized control trial. So I'm looking for something new, something that is recently published in lupus nephritis. And then based on that study, on those studies, I can redesign my PICO. So now I have efficacy and safety of this antibody in active lupus nephritis. Okay. Just click on the study. It's a clinical trial. Okay, now you have a clinical trial studies following the same PICO or a previous meta-analysis with the same PICO because it's published in April 2025. So it's a very recent trial. So you have a fair chances of either updating a previous meta-analysis or doing a new meta-analysis. Okay, so just copy the link. Now you should have multiple tabs so that आपकी स्टडी इधर उधर ना हो जाए. And आपने पीछे होना है. Okay. Hello, Fahad.
Yes, Iftikhar.
Can you tell them more basics about meta-analysis? I'll start from
Yes,
the topic
yes,
selection for meta-analysis and
yes,
PICO.
yes, sure. Yes, sure. I'll just give them an introduction. Hello, everyone. So, let us start from meta-analysis. So, we'll just start from the basics. So, the first question is, what is meta-analysis and why to do meta-analysis? So, what ideas do you guys have? Please kindly share it in the chat so that we can have a more of a collaborative discussion. Okay, I'm waiting for the replies. Okay, pooling of previous studies. Okay. Aisha Qadir is saying it is about the pooling of the to pool the results of RCTs, not necessarily RCTs. We can have observational studies as well. We have already published study papers. That can be a systematic review or meta-analysis. Combined result of multiple research. Yes, obviously. A detailed pool. Okay, so you guys know a lot. You guys know a lot. Can we have a cross-sectional study? Yeah, good question. Analysis. Okay. So now so we have got some ideas, these guys, you can, all of you guys can open your chat so that you guys, we have an open collaboration and we can share our ideas with each other. Okay, so combining different ideas. Okay, so like if I have a question, if drug A is better than drug B, we are comparing two drugs, drug A versus drug B, which one is better for a certain condition, a certain disease. So how do we, how do we end, there are, for example, 10 RCTs, there are, for example, 10 studies comparing drug A and drug B. So how do we decide which drug is better? Okay, you guys can write your comments. How do we decide this? Okay, so for example, there are, for example, 7 articles telling that drug A is better, and there are 3 articles which are telling drug B is better. So what do you think, which drug is better? There are 7 articles telling drug A is better, but there are 3 articles telling drug B is better. What do you guys think? Okay, just tell me A or B. A or B. There are 7 articles telling us that drug A is better, but 3 articles telling us that drug B is better. Okay, so now come on, all of you guys, we have 188. I want 188 replies. Okay, okay, so you, all of you guys are saying drug A. Now, my second question. The second question is in the first seven studies we have like a pooled participant number of 700, but in the rest of the three trials we had 3000. So it's now 700 versus 3000. So now what do you think, which studies are better? So you see, I want 188 replies. Correct. So now, like we are, you know how quickly we shift from drug A to drug B? You guys are getting my idea. You guys are getting my idea, right? So yeah. So the thing is, it's not about the number of studies. It's not about the number of studies. It's about analyzing the studies. It's about seeing the number of participants. It's about seeing the quality of the studies. It's about seeing the publication bias in the studies. It's about Yeah. So a lot of things matter. So we actually what we do is we take a lot of, like, for example, we have 10 studies, we take all of them, we analyze them, we systematically review them, we take a certain PICO, and then we take decisions on the basis of the results. A certain mathematics that are developed, we analyze them according to those. We have 5% chance of error, no more chance of error. If you have more than that, we say that we say that the results are not statistically significant. So there should be less than a 5% chance of error, and we analyze the studies. We take combined effects of the studies. So are you getting me now? You can type your comment. Yeah, perfect. So you guys are getting my basic idea, right? It's not about the number of studies. It's not now. Okay, perfect. You guys are now doing good. You guys are doing good. Now, I want to ask you a second question. You, Maryam Alam Wazir, you are a doctor, okay, and you are sitting at your office. You are treating a certain condition, okay. You are treating, for example, gallstones using not cholecystectomy. You want to use it, treat it using a drug, but there are like uh, two drugs for the condition mentioned in the literature, drug A versus drug B. So, how are you going to decide which drug you are going to prescribe as a physician? And there are again 15 studies on that same topic. You guys can answer as well, all of you. So, what is the guideline? What is the guideline? You guys can tell me. Cross section, no. More efficacy, no. You're sitting down in your office. Evidence, tell me how. You're sitting down in your office. The patient is in front of you. You have 15 studies in front of you. How are you going to study all those studies? How are you going to take out the result? Come on, guys. We have some good answers. Prisma, Meta, we have a lot of good answers. So we are in the discussion. Okay, so now let me tell you the answer. So the answer is, okay, you have a lot of studies in front of you. You cannot go through each one of them. You cannot analyze each study and give. But what if I tell you that I'm the person who is going to combine all those studies and give you a single result and tell you that drug A is better than drug B? So how does that sound to you? How does that sound to you guys? You don't have to go through the 15 studies. You don't have. You don't even need to study the single study that I published. You just need to go to the result of it. Which drug is better? How does that sound, guys? We have 188 guys and only 5 are responding. Come on, guys. We need the energy. Yeah, that sounds perfect, right? So, like, yeah, I just need a single study. I just need a single conclusion that drug A is better than drug B or drug B is better than drug A, because I'm a physician and I do not have time for like reviewing 15 studies and seeing the number of seeing the number of participants and the number of what was the publication bias in the study and all of this. I just need a single result. I just want to prescribe a drug. So now we have like a single result, which is very easy for me. So the thing is that I'm good to go. Are you guys getting me? Now this is what meta-analysis is all about. So let me share my screen. We'll proceed from here, and we're really sorry for all the mishap that happened at the start of the meeting. I hope you guys learned something from here before we can go. Yeah, so three number of studies are the basic that you should have, like, obviously. Okay, now let's go into PubMed. You guys can tell me, you guys can see my screen right again. Can anyone confirm?
Yes, Saad.
Well, yeah. Right. So The chat. I want to turn on the chat. Okay, sure. Perfect. So guys, perfect. Now tell me a condition that we need to search about. Tell me a condition, guys. We need it more of a discussion rather than a lecture, right? You're a physician. Okay, we have tuberculosis, we have Ozempic is a very perfect drug. Bro, everyone is talking about Ozempic right now. Hypertension, okay, this is very well discovered topic. Tell me about something new. Type 2 diabetes mellitus, cancer. Come on, guys. Migraine. Okay, we can search that. Ventricular tachycardia, PCI, celiac disease. Come on, you. These are the physicians sitting down at their offices. They don't know how to treat these conditions. Now we are doing evidence-based medicine. Come on, guys. That's perfect. We have like GBS. We have resistant hypertension. We have also, you're the physicians. You're sitting down. We are the ones who are going to decide based on the literature, based on the evidence what drug are we going to. Okay, so for example, let's study who Ammon, Alian, come on, Newbie, Daniel, osteomyelitis, come on, guys. Okay, let's see, for example, migraine. Okay, guys, also I'm searching. You guys need to learn how to search. Okay, just type migraine. And what should I type? Treatment. Let's see. So meta-analysis, for example. I want to see the meta-analysis. There will be a lot of meta-analysis on this topic. I'm expecting a lot in hundreds, in thousands. Yeah. So the thing is like there are different conditions and a lot of different topics then you have like a lot of things going on. Okay, let me how to close this. Okay. Okay, guys, come on. So we have like you can see here. Okay, I'll also give you a brief overview of PubMed. So in PubMed, you can see like here you have the display option. You can change it into abstract. I like it in abstract because in abstract you get a basic idea of what is going on. You see, this is the abstract, right? So you see, let me tell you the basics. Then we move on to the meta-analysis. Are you guys okay with it? Should I tell you about this, or we should only continue with the meta-analysis thing? Okay, okay, okay. Okay, you guys also want to learn this. Okay, perfect. Continue meta. Yes, gone. Okay, just a brief overview about this. So this is pyramid, the basic thing. You need to learn this. Like you can have abstract, the number of PMID and everything. You can search it by most recent, by the publication date, by the first author and thing. I'll just give you a brief idea here. You have like the name of the journal, you have in which year it was published, month, the DOI and everything. And then you have the topic here, and then you have the authors here, then you have the affiliations if you want to expand it which, and then you have the special number, and then you have the abstract, right? Come on, guys. I'm going to answer all of your questions, don't worry. So for example, we'll see an easy one: comprehensive preventative treatment for episodic migraine. Okay, so this is like if you are having how do we prevent? So now what is the question here? How do we prevent episodic migraine? And we have, yeah, we have like done the systematic review of the all the RCTs. Guys, please don't write on the screen, okay? Perfect. Okay, so here we only come to the conclusion. Okay, so what is it? Thing? Okay, okay, everything is easy. Just stay tuned, okay? Okay, so this is like this targeted therapies and this drug are effective first line options for episodic migraine prevention. So now I'm sitting at an office and I've just got my conclusion that this is an effective therapy. So I don't need to go into all those RCTs this study has analyzed, how many patients they have analyzed, how many studies will go. So you see they have like 15,000 patients in this study. Are you guys following me? You can type your texts. Come on, guys. Yeah. So they have like 15,000 patients here. You see this? And how many studies do they have in this? Uh, Eligible studies were RCTs comparing this. I don't know. They haven't mentioned the number of studies, but usually they do. So we have like 15,000 patients of different RCTs, right? And I don't need to read books. Books. Where the data and the books come from. Just tell the person where the data in the books come from. Do you guys know? Yeah, exactly. Where the data comes from. It comes from right here where we are right now. This is where the data in the books come from. So the data in the books might be outdated, but here you're updated. You're updated. You're here on this day, on this particular day, okay? These you guys know a lot. You guys are amazing. Okay, is this a meta-analysis? Okay, so the basic thing is what is again I'm repeating it because you haven't got as I'm reading your question, you haven't got it. Guys, you guys can also respond to Alian, okay? I'm also responding to him. You guys can also respond to him. Okay, so the thing is this a meta-analysis? RCT is a different thing and meta-analysis is a different thing, okay? RCT, what is RCT? RCT is randomized controlled trial. You divide people into two groups. You give one person one drug, the other person another drug, follow them for some time. You do some intervention and then follow them for some time and see the results then. This is called RCT. But in a meta-analysis, we do nothing like that. What we do what we do is that we take all the results of the RCTs. We do not go to the patients. We only sit on our laptop. That's why this is the best type of study that you need to know about, because it is at a higher level than RCT. Because in RCT you'll have like the results from, for example, 100 patients, but in a meta-analysis you'll have results from thousands of patients. Are you getting me? And that through that too mathematically assessed. Are you guys getting me? Are you guys getting me? Come on, guys. If you're not, I will not move forward unless and until you guys know everything. So we stay here, we stay at this point unless and until you guys don't know the thing. Come on, one guy is saying repeat. Okay, I'll repeat. What is RCT? RCT is randomized controlled trial. What does randomized means? That you randomize patients. For example, you have 20 patients, you randomize 10 patients to group A, 10 patients to group B, give the first group drug A, give the second group drug B, and then assess them for some time and publish a study. This is RCT. Are you guys getting me? This is RCT. Write it down. Yeah, this is RCT. Meta-analysis is nothing like that. Now we have, for example, 10 similar RCTs. We just sit down on our laptop, we collect their data, and as I mentioned previously, if you have like 10 studies and 10 studies are giving you different contrasting results, one is 3 studies are telling that drug A is better and 7 studies are telling that drug B is better. Which one are we going to follow? So this question is answered by the meta-analysis. At least 3 studies are necessary, yeah. So are you guys getting it right now? Do we move forward? Perfect. 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 Okay, so now we have another thing. If you have this condition called the skin condition called rosacea and migraine, so which drug are you guys going to give? So now you are sitting at your office, you have a patient coming in, he has both of these conditions. Which drug are you guys going to give? Come on, guys. Which drug are you guys going to give? Don't know either. I don't know either. We just need to come down. We just need to see this. Come on, guys. I don't know how to read. You guys can read it, okay? Lower definitive conclusions. While we found high migraine prevalence and increase the suspension. No, this is not about treatment. This is something else. So come on. We'll move on to another study, for example. Role of. So this is just to give you guys a brief idea, right? Are you guys getting me right now? How to read it, how to assess it? Yeah, perfect. Perfect. You guys now know everything. Come on, we'll go deeply into one study as well. Okay, we will open it from the website. Whichever is effectiveness and influence of. Okay, this is not. I need something really simple so that everyone can understand it. Risk factors for cervical artery dissection. So, mm, so you know what I'm doing? Meta be done yes, obviously they can be done on clinical trials, as I mentioned. Okay, so now they are studying. Okay, so now there must be like a lot of studies published on this topic, that what are the risk factors. We just lost a study. Yeah, so this is a very good question by Pardeep. Can you guys answer it? What is the difference between a systematic review and a meta-analysis? Very good question. I need answers. I know you guys know a lot. I know you guys know a lot. We'll talk about them. Reva is there. Reva knows a lot. With and without meta-analysis. Come on. Come on, guys. Quantitative analysis. This guy knows it. First, yeah, we know we use it for both. Prisma is used for both. Come on, guys. You guys know a lot. I need 190 responses. Meta-analysis is quantitative. Sadaf knows it. Sadaf knows the game. Come on, guys. Are you guys getting the answer to your question? Meta only observational in RCT is systematic review doesn't involve analysis. I think the one who asked the questions has got his answer right now. So in systematic review, we do not use quantitative analysis. In meta-analysis, we quantitatively analyze the results. I will show you both of them. For example, tell me a topic, guys. Tell me a topic. Pulmonary hypertension. Come on, we'll do it. Come on. Pulmonary hypertension. And first of all, we'll see the systematic review. Okay, is that fine? A systematic literature review. So yeah. So let's open this. Okay, when you click on this, you'll get this, and you'll get the link to the full text. You guys can see this. You guys can see this. Okay. Give me a second, guys. I'm getting some calls. Just a second. I'm here with you guys. Okay. Should I click this link? Okay. Let me click this. We are here. I'll just remove this. I don't know. Maybe just want to see your chat, guys. I don't know. I should move it this way, I think. Okay. So now, what is this systematic review about? First of all, just start. Let's start with systematic review. What is systematic review means that you know the word systematic, like systematic means you go through a very systematic way. One is a narrative review and one is a systematic review. Can you guys tell me what is the difference between a narrative review and a systematic review? I will tell you everything, don't worry, Simmer. What is the difference between a narrative review and a systematic review? Come on, guys, you guys are fast. I expect responses. Do not follow the Prisma guidelines, okay? Those who don't know, please stay with us. Narrative is written, systematic review is based on data, narrative review is basically without some rigid structure. Absolutely, Ariba knows the thing. Come on, guys. Like, the difference is that in narrative you give your opinion. You just search the literature. You do not follow any structure, any framework, and you just give your opinion. For example, I want you to study. Give me an example. I want you to study, for example, what is the best treatment for tuberculosis. Okay, what is the best new treatment for tuberculosis? You go, you search the literature, and you write a paper that I think that from what I studied and from what I understood, I think that this drug is the best new treatment for tuberculosis. But what is this based on? Is this based on some data? No, you haven't given any data. You have just given a few references and you have given your opinion. So narrative review is just like if you're giving your opinion without following a specific structure. Are you guys getting me? When I compare it to systematic review, you'll know it. So systematic review is not like this. You just go and give your opinion. It's not about this. You have to follow certain guidelines, the Prisma guidelines. Uh, okay, just stay with us. We'll find a topic. So we will uh, in systematic review, you find you go through the PICO. It means that you must have what is PICOS? Come on, guys, type it. PICOS means population, intervention, comparison, outcome, and study designs. I repeat, PICOS means PICOS. Population, intervention, comparison, outcome, and study types. See? Okay. So the thing is, you need to follow this. It means that your population must be known, your intervention must be known, your comparison must be known, your outcomes must be known, the type of studies that you are including must be known. For example, we are evaluating this. Evaluate the efficacy and safety of rituximab in the treatment of pulmonary hypertension in patients with connective tissue disease. Now, tell me, what is the population here? Come on, guys. What is the population in this study? The population in this study is patients with pulmonary hypertension and and connective tissue disease. Yes, patients with pulmonary hypertension. And what is the comparison here? Intervention here. What is the intervention here, guys? Exactly. You guys know everything. You guys know everything. So the thing is that this is like the patients with pulmonary hypertension and connective tissue disease. And what is the drug that we are, or comparison, rituximab, and there must be something else that we are comparing it with. That would be our intervention. That would compare population intervention. That would be our comparison. Okay, that would be. It can be placebo. Placebo means that you are giving him nothing. Like so, we have got our population, patients with pulmonary hypertension. We have got our intervention, rituximab. We have got, for example, our comparison. What is comparison? Placebo. And now we will see the outcomes. Okay, guys, are you guys following me? Okay, perfect, perfect. According to the Prisma, these are specific guidelines. Okay. So we have eligible articles. Okay, what is the last S in the PICOS? The study types. So you see which study types they've included. They've included the trials, they've included the cohort studies, they've included the case series, they've included the case reports. Okay? Okay. So, okay, perfect. So this is like, now this is not about giving just an opinion. This is about giving an opinion, but through a very systematic way. You must know your population, you must know your intervention, you must know your comparison, you must know your outcome. And it is not about a few articles that you're just going, like, for example, there are 10 articles and you just studied 3 articles and you're coming up with your opinion. So, this is not what you should do. In a systematic review, you have to give an opinion, a result on the basis of all the available studies in the literature from the time, like, usually people take it from 25-30 years, like from whenever the data is available. So for example, on pulmonary hypertension and on rituximab, like, they've done all the search. And how much studies they've found on this topic? How much studies? They've only found 6 studies on this topic. So you see how much specialized we are going into this field. Only 6 studies are evaluating the efficacy of rituximab in pulmonary hypertension. Okay, so then, yeah, okay. So then they have taken the results. They have taken the conclusion. Let us see the conclusion so that you guys know. Okay, so most of the patients were from USA and Russia. Okay, pulmonary hypertension was confirmed. Okay, okay, okay. What is the conclusion? Rituximab seemed to be effective and safe in the treatment of pulmonary hypertension. So this is our conclusion, guys. You got it? Yes, we will show you everything. Okay, I'm not going fast because we have some people, some guys who are learning it from the very basics. So I know it might not be that much suitable for you guys, but you have to stay with us. Okay. So Prism are actually the guidelines that you follow while you are conducting a systematic review and meta-analysis. Let us ask the Prisma guidelines. You just type it in Google and you'll see the results. Okay, I need to move it here. Prisma statement, you see the Prisma guidelines. So if I type it here, Prisma guidelines for systematic review and meta-analysis. You will get all of the Prisma guidelines. These are the guidelines that you guys need to follow while conducting systematic review and meta-analysis. Okay, I'll show you how to find a topic as well. Don't worry. So what does Prisma stands for? Preferred reporting items for systematic review and meta-analysis. This website is called Perplexity. Okay, this is a very good website. You guys can use it. It will help you a lot. Yes, this is AI.
Okay, guys. So we were now you understand what is meta-analysis and what is systematic review, and one major difference between systematic review, Saad mentioned very clearly, and we do it quantitatively as well as qualitatively. In quantitative manner, we need analysis. So if outcomes are reported by a study, for example, a study reported that there were 50 patients, 100 patients, and 100 patients were randomized to two groups. I will share my screen when when I need to share. Just listen. Just listen. Okay. So no, I'm not sharing my screen. I'm just telling you guys. Okay. So now you have a clinical trials. Okay, I'll share my screen to make it more easier for you guys. Okay. Now you can see my screen, and we have, for example, steroids. Steroids and nephritis. We have steroids and nephritis, and we have a clinical trial uh, on steroids in nephritis. The clinical trials, the randomized control trial, took 100 patients and randomized them into two groups. Group A, receiving steroid, and Group B, receiving placebo. Placebo is a non-effective drug. It has no efficacy. Okay. So we have two groups. Group A receiving steroids, Group B receiving placebo. Now, in systematic review, we only assess, okay, so the Group A is receiving steroids and Group B is receiving placebo, and they given their results. They have given the results. And now we have results like, for example, I'll give you an example that uh, decrease in reduction in pain. Yeah. A reduction in proteinuria. Now you have 50 patients in Group A and 50 patients in Group B. Reduction in Group A, out of total 50 patients, there were 35 patients who reported that they had decrease in their proteinuria using steroids. So in group A, 35 out of 50 proteinuria. Okay, now you have group B and 23 out of patients received reported reduction in proteinuria. Now you can say that group A receiving steroids has better efficacy in nephritis. So you are saying it qualitatively, you are assessing quality. And just by seeing the results, you are assessing something and you are writing your own results based on this. But in meta-analysis, you will pool these results. This is just one study, one single RCT giving me these results. There would be a lot of other RCTs. Second RCT, third RCT, fourth RCT, there will be a lot of RCTs. So, assessing the results quantitatively, I would need a meta analysis to assess their results. And how would I assess their results? We will cover this in data extraction and data analysis part. So, wait for that part. And now we will jump to how to select a topic for meta-analysis. So this is all about systematic review and meta-analysis. In systematic review, I am just assessing them कि यार ये मुझे इसकी quality क्या आ रही है. Results, just not doing any analysis, just by seeing the results and assessing, building my review that, okay, group A has better efficacy in reduction in proteinuria as compared to placebo. Analysis, I would have to I have to do the analysis of these mathematical values, quantitative analysis. Okay, now we are going back to the topic selection. Okay, so this is PubMed. I just searched for nephritis, lupus nephritis. You just search for any disease, pulmonary hypertension, lupus nephritis, rheumatoid arthritis, fibromyalgia, any disease. Just search for it, okay? And then apply 1-year filter plus clinical trials plus randomized control trial. Okay, do these three things. And then select any topic. For example, this one. Mesorbine or cyclophosphamide for lupus nephritis. So they are comparing mesorbine with cyclophosphamide for lupus nephritis. So now we have to look for a previous meta-analysis on this PICO. So what we can do, just simply copy this, go to ChatGPT, now you have a search string. Okay, so open another tab for PubMed and paste your string. Remove the filter and apply filter for meta-analysis. So you don't have any meta-analysis, you are applying it manually. Now, you can next go to Groq AI, and ask Groq So, Groq, find me. Okay. Now Groq will find you, confirm you whether an existing meta-analysis is published on this PICO or not. What is Web of Science and Embase? These are databases. Is this paid? No, this is not paid. This is free version. Sir, can we use Perplexity? Yes, you can use Perplexity as well. I'm using Groq. It suits me more than any other AI, so I'm using Groq. You can use any other AI, but I would suggest Groq more better than any other AI in research. Groq is not paid. Train is database. So now Groq is finding me any published meta-analysis on what I have given to Groq. Sorry. Groq time. Um, wait, okay. Now Groq is searching. Hello, I have um Amizarbine or cyclophosphamide for lupus nephritis, a randomized clinical trial. It's a randomized trial. No meta-analysis exists on this topic. Okay, no any other meta-analysis. Okay, now you can go to um, ask Groq again. Now find me all original studies published on this. Now we are looking for 3 studies at least published on this PICO. We don't have any meta-analysis. So if we find 3 studies at least on a same PICO, then we have a potential topic and we can confirm the viability of that potential topic in primary or secondary screening. So we have already one study, this one, and we are looking for 2 more studies. Also, in the meantime, you can search Prospero if someone searching Prospero का ये फायदा होगा कि if someone has not published their meta-analysis yet and they have registered on Prospero, तो वहाँ से भी you get idea of whether a meta-analysis exists on this or not. Okay, search it. We have four results: efficacy and safety of immunosuppression treatment for operative effect. This is not. No. Okay. No registered meta-analysis on PROSPERO as well. We have a potential topic. Now Groq is helping us finding other studies. We have already a published study, this one. Now we have to look for two other studies at least. Where is Groq? Okay. Intervention. Oral methadone plus glucocorticoids versus, no, this is not following our PICO. Mm, plus glucocorticoid foods. Okay. This one is following our PICO. Low dose IV cyclophosphamide plus oral methadone. Steroid. Okay, this is following our PICO as well. Oral methadone plus high dose steroids. No, this is not following our PICO. High dose steroid plus, no, tricycle antidepressant, no. Oral methadone plus steroid. Okay, this is following PICO. So we have some potential studies. Let's assess them. Efficacy of mesoribine in the treatment of systematic lupus erythematosus in children. We are not assessing only SLE, it's SLE inducing nephritis. Okay, this is following our PICO. Population is slightly different. This is a pediatric population, but we can still take it. Okay. Study of the efficacy of mesoribin in lupus nephritis in Chinese patients. Are they comparing it with steroids as well? Let's find out. No, only mesoribin. Okay, got it. Any other? One plus steroid. Okay, this one. Okay, we have one other drug as well, but if they have given their results separately for each drug, then we can take this study as well. This one, and the previous one. This one. Now we have three potential studies following our PICO, and we can do our primary screening, and then we can confirm the viability of our topic. So this is the best method. This is the best way to find a topic. Okay, let's try another one. Another method is go to a journal. For example, I go to a journal of any random journal, gastrointestinal cancer, any random journal. Ask ChatGPT to give you a list of journals. Go to any journal and look for their latest articles. Find something more simpler. Okay, this looks interesting. Safety and efficacy of gastric endoscopic submucosal dissection in a non-academic Western center. Okay, this is a retrospective study. Safety and efficacy of gastric endoscopic submucosal dissection in a non-academic Western center. Let's assess their PICO. What is their true PICO? I didn't get their PICO. Population patient with gastric lesion, early gastric cancer are okay. And intervention is endoscopic submucosal dissection, comparison, outcomes. Okay. Now, if we have a study, where is the study? We have a study on a certain PICO, a recent study. And look, now what we can do, what should be done next? I'm asking a question. Answer me, guys. Can we include case report? No. We can, but it's uh you have to justify it, and there are a lot of problems with including case report in meta-analysis. So I recommend don't include any case report. What if meta-analysis is published in any F1 journal? Can't we submit it to other? No. Prospero, what is this thing? Prospero mean when you are doing a meta-analysis, you have to register your protocols on a website, and the website name is Prospero. You have to register your protocol. You have to register what is your PICO, what is number of studies you have taken, and all this information. I repeat Prospero point. Okay, Prospero is a website. So Prospero का फायदा ये होता है, the benefit of Prospero is like if I am doing a meta-analysis, I have not completed my meta-analysis yet. I'm just doing meta-analysis. I'll have to register my protocol on Prospero, a website. This is a website, Prospero. I'll show you guys. Wait. This is Prospero. I'll have to register my protocol on Prospero. Now, I have not submitted my meta-analysis yet, but if someone else like Zishan wants to do a meta-analysis on a PICO, he'll search the PICO on Prospero. And if he see that Iftikhar has already registered this PICO on Prospero, I should not go for it because this is already registered. Iftikhar might have done a lot of work in his meta-analysis, so it's not something beneficial for me to start this meta-analysis. I'll go for something else. So on Prospero, you register your protocol before you publish it. So it helps other researchers to uh, select their topic carefully. Also, this is the National Institute for Health and Care Research for the United States. So every PRISMA guideline studies like systematic reviews and meta-analysis should be registered here. Okay, guys. Now we have this trial, a new published trial. What should we do next? If I want to conduct a meta-analysis on this trial and I want to assess, is it possible for me to conduct a meta-analysis on this topic or not? What should I do next? Answer me, guys. What if I have more than one comparator? For example, placebo in 3 RCTs, active comparator in 2 RCTs. Can you do that? That is something called network meta-analysis, not simple meta-analysis. Can we see what topics are registered on Prospero? Yes, you can search as like I searched this topic and now I am getting 4 results. So you can search any icon on Prospero and then you can see the results. Okay, if we select a topic for meta, we have to go through RCTs with same intervention comparison as our PICO. Yes. Is a strong meta-analysis the one which sticks to RCTs for its analysis, or the one which includes all types? Um, Strong meta-analysis is the one which includes more studies with more sample size, with less heterogeneity and less publication bias. Not the study with more with only RCTs or all type of studies. What if there is a network meta on a topic? Can we say no? You cannot do meta-analysis if there is a network meta on a topic. Okay, guys, I asked a question. We have like I just randomly searched this journal, went to recently published articles, and opened their studies. And now I want to conduct a meta-analysis on this. What should I do next? Would you please repeat the journal thing? Okay, I will repeat this. Journal. I have just randomly searched a journal on Google. Journal of Gastrointestinal Cancer. You can search any journal, or you can ask ChatGPT to give you a list of journals. ChatGPT will give you a list of journals, and then uh, select any of them, search it, go to recently published articles, and select any original study like this one. Now, what should I do next? Make a PICO. Yes, yes, guys. You guys are getting my point. Okay, now we have formulated. Okay, I stopped sharing my screen. Sorry. Okay, now I have formulated my PICO. I'll design a search string. Go to PubMed and paste search string. Apply the meta-analysis filter. Okay, efficacy of local MS. What was our PICO? Um, our PICO was population gastric lesion, early gastric cancer. Okay, intervention, endoscopic mucosal dissection. Comparison not no it's placebo most likely in outcomes. Okay. So, efficacy of local homeostatic agent for endoscopic submucosal dissection, a meta-analysis. Um, no, this is not following our PICO, I think. This is not following our PICO. Endoscopic submucosal dissection of gastric oh, there are a lot of meta-analysis on these topics. We should switch it. Okay. Search the journal again. Someone with name Taruba is repeatedly Taruba. Sorry, I have to remove him. Okay. Go to the journal again and look for another paper. Gallbladder cancer and peritoneal metastasis is any role of this is a review article. This is interesting. What are the benefits of neoadjuvant immunotherapy versus chemotherapy in local advanced esophageal squamous cell carcinoma? This is a retrospective study. Okay. Design a search string on this. Go to ChatGPT. Most of the meta-analysis you can find them on PubMed. There are other databases as well, but PubMed helps you a lot. What is our population? Patient with locally advanced esophageal squamous cell carcinoma. Intervention is neoadjuvant immunochemotherapy plus chemo plus immunocheckpoints inhibitors. Okay, chemo plus immunocheckpoints inhibitor. Comparison: neoadjuvant chemotherapy alone. Outcome: survival. Okay. Oh, published in 2023, and we have a recent study. Okay, we can update this meta-analysis. Oh yes, there is another study in non-adjuvant chemotherapy inhibitor. Guys, let's make the PICO. Okay. With or without? This is the point, the whole point. And the above one. Hmm, we have recent meta-analysis on this. So immunochemotherapy versus chemotherapy. They are comparing immunochemotherapy with chemotherapy. And the recent meta-analysis, there is no chemo. With and without. With and without is the point. What do you guys think? Are they matching or not? Are they matching or not? Not matching, no? Meta is getting out of stock these days. We need to consider network meta-analysis. You're right. They are not making. We should remove the meta-analysis filter, and we should click on the randomized control trials and look for some trials. It should not be with or without. It should be versus. It should be a comparison. No, no. This one. This one is making our PICO. This study. Okay. Now we can ask Groq. It will take some time. And then Groq, like if we are missing a study published in a journal that is not PubMed index, that is uh, other databases index, and we might be missing some studies. So Groq help us getting those studies. So you should not miss any study. That when you are doing screening, that is a separate thing. I'm talking about topic selection, checking viability. It's not difficult to find RCTs or cohort which match our PICO. It is, but you have to try. You have to change your PICO again and again. Okay, Groq is thinking. Guys, Groq is very, very crucial for research. Learn use how to use Groq in research. It will help you a lot. Okay, Groq is still thinking. Too slow, like my internet. Groq is searching all the journals, all databases. So, like, if instead of doing it manually, I would recommend do it manually plus use ChatGPT. 2 मिनट सोचने के बाद ग्रोक मुझे रिजल्ट्स देता है. The first one is these are all immunity checkpoints with okay, perfect. The second one is following our PICO as well. So two studies are following our PICO. One published in 2024, another one published in 2024 as well, and this one published in 2025. So now we have three potential studies for meta-analysis. Now what you should do next, do primary screening. And we will be teaching you guys how to do primary screening in tomorrow's session, inshallah. So this is the strategy to find topics for meta-analysis. The first strategy was search any random disease on PubMed and then look for a meta-analysis or look for RCTs and uh, make sure that there is no meta-analysis on the PICO. And if there is a meta-analysis, the meta-analysis should be at least 2 or 3 years older, and there should be recently published studies following the same PICO so that you can update the previous meta-analysis. Or if you have a meta-analysis existing on a PICO, then you should switch the topic. You should change your PICO. The second method that I shared with you guys was search any random journal and go to any recently published study like this one, and then generate your PICO, search on PubMed, search on Groq, and confirm if other studies following the same PICO exist and there is no meta-analysis. And if there is a meta-analysis, you have a space to update the meta-analysis. So this is all about the topic selection. Now the third method and the most effective method and the most I would say, okay. So now you have Groq. Now you're all dependent on Groq. You are studying for USMAD, you are studying for your prof, and you saw something in your textbook, and now you want to assess, you want to find out, can I do a meta-analysis on this topic or not? Like, for example, you saw that um, there is there is a very weak association between rotavirus and Guillain-Barré syndrome, but there's like, let's search it. Let me search it. Okay, so hey group, I was studying this topic and find out that there is a very weak association between rotavirus and Guillain-Barré syndrome. Okay, this is Groq. This is how you can use Groq. I'll be using ChatGPT as well. Something else. Example, you are studying hemorrhoids. That there are different treatment options for hemorrhoids. Some doctors says that medical therapy is more efficient. Some says that uh, lifestyle modification is more efficient. Some says that surgical option is more efficient. So now you are confused and you want to create a space for network meta-analysis, and you are uh, uh, you want to find out. So now ChatGPT can help you. Now, what's the difference between ChatGPT and Groq is Groq understands the criteria for meta-analysis. PICO thing, There should be no other meta. There should be at least three studies. All these criteria. But ChatGPT doesn't understand this. So I have to tell ChatGPT, hello, ChatGPT. The criteria for meta-analysis for doing a new meta-analysis is there should be no previous SRMX, systematic review or meta-analysis or network meta-analysis. There should be at least three studies following the same PICO. So there are different treatment. There are different options for hemorrhoid. Find me a space. Okay, before this, and to update a previous meta-analysis, there should be recent studies covering the covering more than 25% population of the previous meta-analysis. For example, in previous meta-analysis, the population of the combined RCTs are like 800. Now you have a recently published RCTs, two RCTs, and their sample size is 300. So now you are covering more than 25% of the previous uh, sample size. But if you have uh, 800 previous population and 100 or 70 or 80 new population, then this is not a strong rationale for uh, updating the previous meta-analysis. So just okay, find me a space for new or updating meta or network meta-analysis to conduct. Guys, ChatGPT is like a vehicle, a car, not a Tesla car, but a non-autopilot car. And you are the driver. The skills, the speed, everything, it depends on you. Uh, you have the accelerator, you have the gear, you have the steering. So the prompt, this is your driving skills. Prompt is your skills. So learn how to uh, 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 learning some new prompts, some valuable prompts, and some well-directed prompts. Like I was directing ChatGPT to a certain direction and providing all the information because I know if I don't, it will give me some bullshit information. So these new prompts, Ciclo, they'll help you a lot. Okay, now ChatGPT is giving me a space for meta-analysis, if possible or not. तो क्या कहता है चैट जीपीटी देखा you have outlined solid criteria for initiating a new meta-analysis or updating one. Okay, now potential meta-analysis are updated areas. Hemorrhoidal artery embolization versus hemorrhoidectomy. Okay, now you can compare hemorrhoidal artery embolization versus hemorrhoidectomy. A recent RCT found similar effectiveness in resolving bleeding symptoms. This is a single trial, no meta-analysis is premature, but growing interest in this topic. Okay, Now you have different options. Just search one by one surgical versus conservative treatment. No meta analysis. A new meta analysis compared surgical versus non invasive conservative treatment and found surgery. This meta analysis meet the updated criteria unless newer trials after September 2024 have added. Okay, so this one as well. Botanic agents, you can compare them with anything. So this is a space for you. They can give you, ChatGPT can give you a specific direction, a space, and now it totally depends on you to assess them. The way I assess them, make PICO for one by one, search the PICO, find out there is no previous meta-analysis, and there are three or more studies, uh, RCTs or any other regional studies that are following your PICO. Also, don't forget to search the Prospero. Okay, now go to Groq. Groq भी हमने कुछ दिया था. Still thinking? Groq को क्या हुआ है? चलो रिफ्रेश करते हैं. Okay, evidence on rotavirus. Let refresh. God study. Limited space. This is a very limited space. So if Groq tells you that space is limited, leave it. Search for something else. So this is all about the three techniques that you can use for finding a topic for meta-analysis. The first one was using PubMed all alone. The second one was visiting any journal and then select any recently published article, formulate your PICO and search for it. And the third one was using ChatGPT and Groq entirely. So these are the techniques. Follow these techniques. We have recorded this session. Watch it again and follow these techniques. And I hope, I'm sure, in fact, that these will help you a lot finding some topics. Okay, now I'll read some chats. Which one is most accurate? The one with finding a topic on search for any journal and find a topic like this one, formulate the PICO and then look for it. This one is the most effective one, but it takes some time and some energy. And the one with ChatGPT and Groq entirely, it's a bit more faster and more easier technique. Yes, we are getting recording. The prompt is excellent. Thank you, Ahmed. Do you have a list of prompts? What do you mean by space? Space mean आपके पास जगह है. Do you have option? Do you have rationale? Do you have objectives for meta-analysis? I'll share my prompts with you guys. Can you show one example of physical therapy related topic? Fatina Fahim. Physical therapy related topic. Okay. I will show. Can you text me, please? I may find like it's not easier for me to think on the spot and like search for something. let me think about something physical therapy related. You can look for something like physical therapy versus pharmacological therapy and uh, joint dislocation, sciatic, rheumatoid arthritis, uh, mm, all other arthritis, and spine related problems. You can compare pharmacotherapy versus surgery versus physical therapy. He told two ways, one through journal and seeing recent article, and other through your preferred topic by changing PICO. Yes, Aisha, you're right. Sir, like tomorrow, can you make points of how to find topic for meta-analysis? Yes, I will. Noor, I'll make some points. Can you share your prompt? I'll share my prompt plus uh, these methods in a Google Docs and will share with you in IRC group. Hussein, difference between meta and network meta-analysis. Okay, Sakran, this is a very good question. So now you are comparing A with B. For example, you are comparing chemotherapy with immunotherapy. You have trials comparing chemotherapy with immunotherapy, and you can pool them in a meta-analysis. This is one meta-analysis. There is another meta-analysis comparing lifestyle modification, sorry, laser therapy with immunotherapy. This is another study, another trials, and you published a meta-analysis on this. So now you have published meta-analysis on two different comparison: immunotherapy versus chemotherapy. One meta-analysis, chemotherapy versus laser therapy. Another meta-analysis. Now you have compared laser therapy with immunotherapy, but you have not compared laser therapy with chemotherapy. You have compared, okay, I'll go to my Google Docs. ऐसे कहने से आप लोगों को भी भूल जाएगा, मुझे भी भूल जाएगा. First meta, first RCT. The first group of RCTs compared immunotherapy versus chemotherapy for cancer. And now you have conducted a meta-analysis on this. Okay. Second group. Now, the second group, which compared laser therapy versus chemotherapy. Now you can conduct another meta-analysis on this. What if? Is there any association between laser therapy and immunotherapy? Guys, there is no association, right? The first group of RCTs compared immunotherapy versus chemotherapy. The second group of RCTs compared chemotherapy versus laser therapy. But there is not single trial that compared laser versus immunotherapy. And for meta-analysis, if you are going to conduct a meta-analysis, you will conduct a meta-analysis for this. You will conduct a meta-analysis for first group, separate meta-analysis for this, and a separate meta-analysis for this. Two different meta-analysis. But in network meta-analysis, this is the difference between meta-analysis and network meta-analysis. In network meta-analysis, you can conduct a single study, a single network meta-analysis of these different interventions. All four interventions. So, by doing a network meta, You are comparing chemo versus laser directly, immuno versus chemo directly, and laser versus immuno indirectly, because you are including all the RCTs in a single study. So you are indirectly comparing laser versus immunotherapy. And by doing this, you are saving millions of dollars because we have compared these two and these two. Now we need another sets of trials that compare immunotherapy with laser therapy. But if you do a network meta-analysis, then there is no need for RCTs. You have indirectly compared laser therapy with immunotherapy, and you have saved millions of dollars by doing a network meta-analysis because it takes millions of dollars for conducting a single randomized controlled trial. So you have saved millions of dollars. That's why they literally worship the physician in the United States. They worship the new researchers, the meta-analysis, the network meta-analysis. So if you have skill sets in meta-analysis, if you have skill set in network meta-analysis, you will be like a god to them. They'll respect you. They'll create space for you. They'll welcome you. They will do anything. They'll make your pathway easier. They will make your match pathway easier. They will make your observership pathways easier. They'll make your postdoc pathway easier just because you have skills in these studies. So because you are saving dollars, you are saving money, you are saving time. So that's why meta-analysis and network meta-analysis are so important. And the one major drawback of meta-analysis and network meta-analysis is saturation. There is very limited space in these studies. Everyone is doing to uh, conduct meta-analysis. Everyone is trying to conduct a network meta-analysis, and trials are limited. So that's why I innovated these different techniques of finding topics for meta-analysis and network meta-analysis. So by applying these techniques, you can get potential topics, get more and more topics, publish more and more topics, and they'll help you a lot in your research journey, inshallah. Okay guys, any other question? I hope मैंने बहुत simple words में explain किया है. Can should I repeat it again? Should I repeat it if there is any confusion? Thank you so much, Minahal. Thank you so much, Javeria. Any question, guys, about the difference between network meta-analysis and meta-analysis? Muhammad Ahmad, I have tried to explain this. If you have any confusion, you can ask again. There are different there are different phases of clinical trials. Which one should include? The one recently published, because the one recently published is the updated one. Network mana save RCTs. Okay, Michelle, I will explain it again. Okay, listen to it carefully. Okay, Michelle, and all other listening. There is a study. There are 10 RCTs which compared immunotherapy versus chemotherapy for cancer. They want to assess uh, immunotherapy versus chemotherapy, which one is better for cancer. And there are another 22 RCTs published that compared chemotherapy versus laser for cancer. Which one is better? Is chemo better? Is laser better? Which one is better? There are 22 answers. Now, Michelle wants to conduct a meta-analysis on this one, first group. Okay, मिशेल ने ये स्टडी कंडक्ट किया है मेटा एनालिसिस एंड नाउ मिशेल के पास एविडेंस है दैट कैन कंपेयर इम्यूनो विद कीमो एंड ही कैन से दैट the immunity is better, immunotherapy is better or chemotherapy is better for cancer. Okay, Dr. Ibrahim conducts another meta-analysis and compared I will conduct another meta-analysis and publish it. And find out whether chemotherapy is better for cancer or laser therapy, esophageal cancer. It's better for esophageal cancer or gastric cancer. Okay, now he has evidences that, uh, for example, chemo is better than laser in gastric cancer. So there were 10 RCTs published on this, 22 RCTs published on this. Now I am with someone in government, someone with who makes policies, and yeah, or someone in FDA. And I read all these published meta-analysis. I won't read clinical trials. I can't read 10 RCTs. It will be better for me to read a single study, a meta-analysis. So this is why meta-analysis is important. And meta-analysis by Mitchell, by Ibrahim. So if I am someone in FDA, I won't read these 10 RCTs. I will read the meta-analysis published by Mitchell and I'll assess whether immunotherapy is better or chemotherapy is better in gastric cancer. And also, I will read a meta-analysis published by Ibrahim whether chemotherapy is better or laser is better for gastric cancer. Okay, now I have evidence of direct comparison between immuno versus chemo and chemo versus laser. Now, what I can do is I'll give orders that we need more trials to compare laser. We need more trials to compare immuno with laser for cancer because there is no trial comparing laser therapy with immunotherapy. So, someone, Yasser, Yasser aa jata hai. Okay, sir, Iftikhar, there is no need to conduct another trial. I can save your money, I can save your time. I'll do a network meta-analysis. I will do a network meta-analysis, and a network meta-analysis will compare immuno with chemo plus chemo with laser directly and immuno with laser indirectly. हाँ, ये आप अपनी तो देख सकते हो जब हम इंशाल्लाह नेटवर्क मेटा करेंगे soon. So now Yasser published a network meta-analysis comparing chemo with laser directly and immuno with chemo directly and laser with immuno indirectly. So I will not direct any fund for other RCTs comparing laser with immuno because now I have evidence with network meta published by Yasser that okay, there is comparison between laser and immuno. Which one is better for gastric cancer? So this is network meta analysis. Okay. Can we do network meta on already published two meta? No. You can do network meta on RCTs only. Second, okay. So if there is only older RCT 2010 and 2000, but no meta matching or PICO, can we still do a meta? Yes, you can do. I'll make points. Exhausted. मैं exhausted नहीं हूँ. If you're exhausted, you can you can take a break. पानी पी लो. I'm not exhausted. I'm enjoying it, guys. I'm enjoying it. I'm literally enjoying it. Okay. Any other questions? Okay, no other question. Okay, guys, we are enjoying it too. Search string for different databases. ChatGPT can help you. ChatGPT can help you for making search string for different databases. Do not lose your energy by making it manually. Please tell the databases for search. They go. Opus, Google Scholar, Embase, and Cochrane. These are different databases and PubMed, obviously.